Our next topic, launching a new integrated health clinic, counting up the cost. And in this session, you're going to learn, the journey to the launch, how to fund the vision, how to scale for greater success, and how collaboration is the key. We're going to be talking about Shawn Pearson. She's the CEO of Zion Institute, and a little bit about Shawn as a social impact entrepreneur. Her innovative work has resulted in long-lasting legacy-building community impact. In 2022, she was named the Minority Business Enterprise of the Year by the Hispanic Chamber of Commerce, Women with Vision by the National Association of Women Business Owners, and the Horace Steele Child Advocacy Award. She's also named as one of the top 100 CEOs in Phoenix by Titan 100 in 2022 and 2023, and is co-founder and CEO of Zion Institute. She operates a campus in South Phoenix, Arizona called The Well at Zion Institute, which offers transformational resources to community, including childcare, preschool, social enterprise development, integrated health services, family preservation services, and emergency resources. And in her personal life, she is known as a wife, mother of 6, grandmother of 14, transformational speaker, teacher, and a published author and solutionist. And without further ado, we welcome Shawn to the summit. Shawn, how are you?
Good morning. I'm doing very well. I'm inspired after listening to Emil, a very young and powerful leader. I love his innocence about this work, and so it was rejuvenating to
Well,
listen.
it's no coincidence that you guys went back to back here. So we're looking forward to feed off that energy and everything that you're going to share on this enlightening topic with us.
Well, thank you. I appreciate the opportunity to actually be here with you all. I am learning so much from a worldview for the work that I'm doing at a very grassroots level here in Arizona. So thank you for the opportunity.
Our pleasure.
So
And the stage is yours.
Okay. I'm going to go ahead and share my screen as soon as I figure out which one to open. Give me 30 seconds. I'm not part of the tech world. So
take your time.
Here we go. Let's see. I'm sharing. Go Windows. Here we go. I'm smarter than I thought I was. How about that? My generation is learning all of the AI and all of the technology benefits, which are a huge blessing. Good morning. Good
Thank you.
To all of you. I'm Shawn Pearson. I am founder and CEO of Zion Institute here in Phoenix, Arizona. And much of what we're hearing has been on a world stage, which is very exciting for me. And I want to just say that the key to applying everything that I'm going to share with you will be adapting it to the community that you are in, because one thing that is consistent about the social determinants of health is that there's need everywhere. The lack can be addressed just by adapting these simple principles that I'm going to share. So I'll be presenting to you how to launch a nonprofit integrated health clinic and how collaboration is absolutely key. So my goals is to just share some knowledge and experience about the work that I've done, some key steps in preparation for that work, the essentials for implementation, and of course, some tools that will help you scale faster. A little bit about Zion Institute. We are a 501c3. We're located in Phoenix, Arizona. We're about 13 years old now in terms of the work that is currently being done. But our nonprofit exists to break cycles of generational poverty. And as you could hear by my introduction, my hands are in pots, lots of places. And that's because of the social determinants of health that are in the community in which I serve. But the goal of Zion is to actually create different transformational program models that will address those social determinants of health, meaning that whatever the need is in that community, we figure out how to help those community residents and those agencies and churches and businesses monetize their mission to bring solutions to their community. And then those models are something that we make replicable in other communities so that there's no lack of access to those resources. And as Christopher shared, we are located in South Phoenix, Arizona. We have a campus that we refer to as the Well, where individuals can be met at their point of need. So there's no wrong door, depending on what their need might be. as they enter the campus, we're figuring out what is the solution they need to make sure that their life can be improved and that they can go on giving what they have to offer to their community. So, on your journey to launch, as you're interested in launching a nonprofit healthcare startup, it's important to know who you are. What are the gifts that you are bringing to the table, the experience that you are bringing to the table, so that you can actually leverage that against what's already there in the community. And there's something that's very important if you're establishing as a nonprofit. Remember that a nonprofit is a tax designation, it's not a business model. So it doesn't mean you can't make money. It just means how you use that money that you make is for the good and perpetuation of the programs and services that you offer. And so I want to do away with the misnomer that a nonprofit means that you have to always be scrounging, always be borrowing, begging, be dependent on the donors. That is the traditional model for nonprofit operations. But as a tax designation, you're not prevented from raising all the money you can through providing services and solutions to the communities that you might want to serve. And in that, as I said, you want to know what your strengths are as you come to the table to bring a solution to the communities you want to serve, and what are your vulnerabilities as well, so that you can really focus on where do you need to leverage up with existing resources that are there in the community, or who do you need to bring to the table that can help you be successful in this work. Then next, you want to make sure that you've identified the community need. We had a couple of presenters earlier that shared that it's not good to come into a community with your idea of what the solution should be, but really understanding the community that you are in. And that means taking a look at the social determinants of health that are in that particular community. Just because there's poverty or just because there's disenfranchisement or a lack of access to one particular resource doesn't mean that intellectual capital is absent from that community. And so there might be a wealth of assets that are right there under your nose as you come in to provide a solution for healthcare. There might definitely be some other community-based agencies and partners and advocates and even residents that are in that area that can help you stand up the work that you're trying to accomplish. And so then next, I want to encourage that you would do a neighborhood asset map. Discover what's around you, what already exists to be leveraged, what are the actual gaps in that space, so that as you design your particular model for your integrated clinic, integration won't necessarily look like traditional primary care with just a little bit of behavioral health sprinkled in and then all the specialties around it. But you want to make sure that you're building something that is unique to the needs of the specific community that you are trying to serve. And through that market research that you're going to do, you'll identify who your competitors are as well as your collaborators. Now, I happen to be one to say that there's so much need that there's no competitor. Even if they're in the same field that I'm in, there may be something that I can offer to someone that another agency can't, or they may be able to offer something to the clients and patients that we serve that I would want to make that referral. So there's no competition when there's such great need in the communities all around the world. So look at it through a different lens of how can we share what's there and maybe have 50% of something instead of 100% of nothing because we can't get off the ground. And then the next important thing that I would encourage about your launch is really counting up the cost. And I'm referring to not just the financial resources, but the time investment that it's going to take as a startup. If you're like me, I'm a community mobilizer. I didn't come from wealth, had a lot of kids and a whole lot of grandkids, as you can see through my bio. And so there weren't necessarily a lot of financial resources available as I got started from my own dollars, but the network of individuals that I'm connected to made all the difference in the world. But it took a lot of my time investment, as Emil just referred to. There's so much about your own life that you'll discover as you're launching a nonprofit, because it takes a lot of mental and emotional energy as well as the physical energy from knocking on doors and telling your story. And then the last thing you want to make sure that you have in place before you launch is a strategic plan and an implementation strategy. So walk through everything you understand that it's going to take, figure out the resources that you're going to need for that, put together a timeline that actually goes with that work so that you understand that this is not something that is an overnight. This is something that is going to take you possibly some months to put into place, But if you're strategic about how you do it, you can leverage what is already out there to help you propel into a launch much faster. And that implementation strategy, as I said, should include your time, the gifts you bring to the table, how much money you have available to get it started, and how much more do you need so that you can put together a realistic timeline as you begin to announce to the world that you're coming out to share and create solutions. And so, a big part of what we experienced at Zion was how do we fund the vision? I happen to serve in a community that is what I call overserviced yet underserved. And by that, I mean there were a number of agencies that were coming into the community where I happen to live, work, worship, and serve that didn't know us. They weren't in relationship with us. So they had tons of money, but the services weren't reaching our community. So, being a resident and coming into this field of healthcare, in particular, integrated healthcare, was a challenge for us. I was in the same space with very large healthcare providers that had all the bells and whistles, but not necessarily the relationships. And so I had to learn all of these steps through trial and error, or I call it Hard Knock University. So I have a great degree, several from this university. But funding this vision really required an understanding of all of these steps that I'm about to share. And so, specifically, becoming a licensed provider in the area that we were in, you have to make sure you understand all the nuances and all of the requirements that your state or the area that you're going to serve in. It's important that you understand those guidelines that are essential for obtaining that license because you are providing healthcare services. You're going to have medically trained professionals on staff. You're going to have a facility that is equipped to deliver all of the services in a best practice way according to the state or the government guidelines that are applied to the area that you're in. And then, of course, here locally, there's an application process. I'm sure there's one for whatever area you might be in, but making sure that you are following those steps to the letter. And on the operational side, making sure that you have policies and procedures that line up with the services that you want to offer in accordance with those guidelines, those governmental guidelines. And then internally, having those standard operating procedures. Those procedures are the things that are going to help you flow smoothly, help you be consistent in the way that you deliver service, and help you to expand in a way that's not disruptive to your cash flow and not disruptive to your team. And then, of course, you heard some of the other presenters talk about EHR. The electronic health record systems are crucial. I certainly encourage you to be able to do something that is web-based. You can access it anywhere that you are, but it's important for the HIPAA regulations so that you protect the medical information of all the individuals that you're called to serve. But it's also an apparatus for you to track all of your outcomes, all of the data that you need that will be important for you as you go to apply for grants and tell your story as a nonprofit. Those are the keys to being able to leverage other resources, including other partners that get interested in the work. And so, as you've done all of those things, it's important to also be researching how you secure contracts with the insurance companies. If you're anything like I was, I gave away 90 and I kept 10 for all that was being earned through the work in the earlier years of our nonprofit. But in this healthcare arena, there's such a critical need, but there are also a number of resources that are fee for service. So the insurance companies will pay you to deliver these services. And so you don't necessarily have to depend on grants to sustain you, but those contracts are going to be key to the relationships that allow you to access all of those individuals that you want to serve in the healthcare industry. And so it's important to do the research about who is serving the particular audience that you want to serve, who's providing the insurance coverages for those individuals, as well as who's giving money in those spaces to help you stand up the work that you're being called to do. And then I like to highlight what I call the 4Gs. This is a marketing strategy that I teach to some of our social entrepreneurs. It's get out, get known, get liked, and get paid. So as you're doing your work, as you're preparing to license, it's important that you get out and let others know what you're doing. Share your story, share your vision. You want to be known in the industry, you want to be known in the community that you're in, but it's important that you're known for good things. Be known for telling a story that is accurate about who you are and what you do. Integrity matters. Not just because you're in business, but just the character of you as a leader or a service provider in a community. If you're not trusted, then you still don't gain the traction that you need to be able to serve. So it's important that you're liked. You can be known, but not known for doing good business. So you want to be liked in the community that you're in the network of service providers that you're in, by the insurance companies, by any of the individuals that would be an asset in the healthcare industry in the field that you're in. And positioning yourself that way allows you to get paid. And remember what I said, a nonprofit is not a business model. It is simply your tax designation. So getting paid is not a bad thing. Being able to monetize this work that you do allows you to do more work and expand your vision, hire more people, bring more solutions to community. And so getting paid for the work that you do is just a way to leverage and expand and really scale what you're trying to do, and hopefully even replicate it in other places, like Emil referred to, and being in multiple countries with your work. That would be a fascinating thing to do for your healthcare system. So don't be afraid of the 4Gs. Next, I encourage you to leverage the existing resources. While you're out there getting known and getting liked, you need to also be getting familiar with who else is in the community, who else is a fit to leverage and partner and to collaborate with, and to be able to make referrals or to learn from, just like we're doing on this conference, learning from each other, how you can do what you're doing better. I believe it's certainly important to allow you to not have to be hit by the obstacles that I was hit with. And that's why it's important for me to share the knowledge that I've gained through this journey. I actually did not start off in healthcare. My background is actually nonprofit organizational development. And I landed in healthcare just to create solutions for the community that I lived in, where I saw gaps. And so I brought my gifts of organizational development and a passion for people and community to the table with healthcare providers and with community activists and with community residents. And we all sat down and talked about, what does our community actually need to create access to improved healthcare? And that's how we landed in integrated health services. And the rest is history. We're 2 years into this model, but have 3 others that we're helping to launch with this model locally. And we're creating that collective impact as a network of resource providers. And so leveraging existing resources is going to cut your startup costs potentially, if you can find right partners that are interested in coming to the table to be part of the solution with you. So don't be afraid to collaborate versus compete. I know traditional market tells us, see who your competitors are. What's your edge? What's your niche? Your niche is beautiful, and it's even more fabulous when you connect it to someone else's to be a solution for someone in need. And then lastly, with funding your vision, securing grants as a startup, it has been essential to the work of every new startup that Zion has launched as a social impact incubator, that we have grants at the front end of that work. Being able to tell your story effectively, having that strategic plan, that implementation strategy that has a timeline and a budget attached to it, makes you very attractive for conversations for those venture capitalists, those angel investors, which is what Zion experienced, a number of zero interest loans that allowed us to be able to start this work. And then those monies went back into a social impact fund that continues to repeatedly support other nonprofits that are getting launched, that are creating solutions to community. But it's important to remember that grants should be a seed and not what feeds your nonprofit, because the grants make you so subject to other people's interests and whims and the changing economy and so many other factors that make you vulnerable and make your sustainability questionable if you don't have other sources of revenue. Remember, you're going into healthcare. It's a need that is nationwide, internationally needed. However you want to look at it, even if you want to continue to work at a grassroots level in just the space that you live, work, and serve, grants are only going to sustain you to a certain degree. So if you're interested in making greater impact, certainly consider the grants just as that seed and not what will feed you as you continue to grow your work. So as you've gotten going with your work, you've gotten licensed, your doors are open, you are serving clients and patients, you're filling the needs in your community. It is very important to be okay with starting small and being excellent. One of Zion's guiding principles is service in the spirit of excellence. And so it's okay to be small as you're getting started. Be good at what you do with those small numbers so that you can perfect the work that you are doing before you expand. And so it's important that as you are preparing for growing, that you be consistent in how you're delivering the services and that you monitor what you're doing on a regular basis and analyze the outcomes from the work that you're doing. So maybe you've served 50 people to start. What was their feedback about the services you delivered? What was missing in their experience as they entered your clinic? Who else around the community has stepped into the industry that you might be able to still leverage and create greater impact? So constant evaluation and analysis of the work that you're doing is critical as you prepare to grow. You want to make sure that you're not growing a defective model, but rather you're solidifying your foundation before you move into the next level of growth and service that you're interested in providing. And be okay with adjusting for innovation. There is so much of in the nonprofit industry in particular doing what has always been done as a solution because that's what's always been done. But I would encourage you, having seen that the poverty rate in America has not changed very much in the last 50 years, maybe some of what we're doing might need a little bit of an innovative switch in order for us to create solutions and not just some things that perpetuate the poverty that we're seeing within our community and within our nation. So don't be afraid to be innovative in the way that you approach bringing the solutions for your particular healthcare clinic. Do what's relevant for the population that you are serving. Create those solutions and don't be afraid to add that to the cadre of services that are being offered. Don't go so far off the beaten path that your funding sources, your insurance contracts, and so forth aren't going to support the work that you do, but make sure that you're actually meeting a need, not just building and maintaining the infrastructure of the nonprofit that you've established. Because if you create solutions and you're relevant in this space, as you grow and as you expand, the service that you're offering may not necessarily be the same thing they need 5 years from now, but they'll still need you as a provider. They'll still trust you as a provider because you brought a solution that sustained the community and not just sustained your organization. And so be prepared to grow your audience by telling your story. Tell the wonderful success stories that you've experienced, the individual stories about those families, those people that you've been able to serve with the work that you've done, with the innovation that you've brought to the particular solution of healthcare that you want to offer. Telling your story is critical. If you're not comfortable speaking in front of people, I encourage you, take a class on storytelling. Go to Toastmasters, get in front of small groups of people that you're comfortable talking to and sharing what you've done, sharing what you've experienced, the good, the bad, the ugly, but staying focused on industry standards, making your story relevant to what's happening in healthcare. It's heartfelt work if you're on the nonprofit side. We are typically givers when we're on this side, but make sure that the conversation that you're having, the story that you're telling about what you're doing is relevant to the solutions and the audience of people that you're around. So if you're conversing with your patients, have the story about why you started and ask them for feedback about how you could do better. If you're in an audience of innovators like yourselves, talk about how you all can leverage what you're doing after you've told your story and your experience about what your clinic is offering. Maybe there's someone in the room that has knowledge that you need. And if you tell your stories, they might be able to help you improve your quality processes and maybe change some of your procedures and help you flow a little bit better and generate more revenue for greater sustainability. And likewise, if you're in an audience of individuals who are funding this type of work, you want to be able to tell your story in a way that it highlights your outcomes, it highlights your innovation, and it highlights your passion and commitment to this service so that you can continue to be successful. And then invite them in, bring them together with a call to action, come and be a part of the work that we're doing. Like Emil did in his presentation, we're looking for partners. We're looking for people that will help us gather more data. Don't be afraid to ask for the help when you need it as you're telling your story, so that you can grow not just the audience of people that are you're serving, but the audience of people that are supporting you as you serve. And most passionately for me is the conversation about collaboration. I cannot tell you how impactful collaboration has been to the work that we've done here locally and in the 6 other states that I've been able to work in: California, Indiana, Texas, Florida, and Georgia. Just some incredible things have happened because we were willing to work with others. We haven't stepped into this space believing that we knew it all. We came in looking for who's got something to add to this incredible soup that tastes so good because it's a solution for the community that we're serving. So having those conversations as we stepped into new arenas made all the difference in the world as to how fast we were able to grow and how impactful our work was able to be. Because of collaboration, it expanded what I call our ecosystem. So we've stepped into sectors that I never imagined. We started off just a nonprofit trying to build capacity in a community. We're now in businesses, we're now in churches, we're now in community agencies, we're now in stores, we're now in banks. All of these different sectors came together. Our education district that we're in with over 60 schools is now a part of our collaboration. So we get to reach into those schools K through 12 to provide services to the families that have children attending those schools. And so the expansion never would have happened if we'd not chosen to collaborate. And those new relationships made way for a lot of leveraging of space. So we didn't have to pay for new infrastructure, for a new building. We used mobile medicine and are using mobile medicine to go to the sites where they're at because of those connections that we've been able to make. And so being able to leverage all of those additional resources at no cost because they recognized we had something to offer to them that met a need for the population they were desiring to serve. And so we were able to step right in and co-create what worked for their particular location. And that increased our engagement with our clients that we're serving, those patients that we wanted to reach, from the children to their guardians, their parents, their grandparents, the seniors in the community. It's just a network ripple effect through the engagement that we've done. And it improved the quality of lives for our patients because a number of them couldn't get to our clinic. But through the mobile services, they're going to school 5 days a week. They have access to their teacher, they have access to the nurse's office, and thereby had access to us as medical providers. So the innovation of just stepping out, seeing what the need is, figuring out how we could fill it, created this opportunity for us to really address that community need that we have and ultimately do what we intended, was improve the quality of life for the people that we're serving. And so this, I just wanted to give you a snapshot of collaboration in action. As I said, Zion's a nonprofit that exists to break cycles of generational poverty. And so while we started there, we are in healthcare, we're in community doing a host of things with emergency services. We're in the track of business, creating entrepreneurs. We're in the track of education, making sure that childcare, preschool, our kids are ready, our adults are going through apprenticeships and such. But all of this was a simple result of collaborating with others because we had an interest in doing our healthcare. We had an interest in doing integrated healthcare. But for Zion, integration meant integrating, incorporating anything that created a solution for the individuals that we were called to serve. And so it wasn't just medical services and it wasn't just behavioral health medicine that was attached to that. It wasn't just the specialty medicine that was attached to that for healthcare maintenance, but it was all of the other facets of life that individuals face that prevent them from being the best human being that they can be. And then adding them to the network and inviting them to bring their strengths to the table, it resulted in this wonderful kaleidoscope of different resources and a network of support for everyone that touches Zion. So I want to thank you for giving me this opportunity, and I want to leave you with a few reminders. As you prepare to launch your nonprofit integrated health system, remember innovation and collaboration As you start off, know who you are and what you have to offer. What are you bringing to the table? So you have a realistic picture of the work that you need to do to be solid as you launch. But know the need in the community that you're desiring to serve so that your service model can be specific and intentional to that audience. And then design what you're doing to suit what you're doing in that community. Make it fit who they are, not who you believe they should be. And then you want to leverage grants as seeds, not as your foundation, but as your seeds to launch. And as you look for other sources for fee for service opportunities through healthcare service provision, that is where your sustainability will lie. Look at your grants as an opportunity to seed and to grow. Be okay with starting small and then scaling. It makes a difference if you can be excellent at the stage that you're at and then grow beyond that. And finally, collaborate, collaborate, collaborate. Don't be afraid to share your knowledge. Someone else will share theirs with you, and together you can be better. So again, I thank you all for giving me an opportunity to present. This is my contact information if anyone wanted to reach out and connect intentionally and figure out how we can be great together in this great USA or even abroad internationally. I'm willing to travel and share my knowledge, of course, via Zoom, of course, via the internet, but also in person as well. So thank you for this opportunity, Chris, and I will turn it back over to you.
Shawn, thank you so much. Such valuable information about the 501c and nonprofits, and love what you shared about not being dependent on one source, in this case, a grant. Such great information. And I'm hoping everyone's taking notes, had taken notes, and goes back and listens to this segment that Shawn shared. Such great advice to really move your nonprofit forward. And again, collaboration, collaboration, collaboration. So important. It's so important. I know we got maybe about a minute, Shawn, but if you can answer a question for us, when you're looking at balancing quality care and operational costs in clinics, can you share an example of a collaboration that boosted your clinic's impact?
Absolutely. Currently, our clinic is constructed with multiple service providers who are all separate service providers in various areas. So we share a licensed clinical space with an MD, with a nurse practitioner, with a specialty health provider. And so our overhead cost is shared at the facility by these other providers who need that infrastructure support, but didn't want to pay for the cost of space. And so through that collaboration, different types of providers are welcomed into our space to be able to offer the services to our community. And so that prevented us from having to fund and support those things that we recognize were critical needs to our community.
Thank you so much for all this insight that you shared to us. We highly encourage you, everybody, to reach out to Shawn, get to know her, and collaborate with her. So many great things. Shawn, thank you so much for being here.
I appreciate the opportunity, Christopher. Thank you.
Thank you.